Abuse and neglect. According to the Nursing Home Reform Act of 1987, all residents in nursing homes are entitled to receive quality care and live in an environment that improves or maintains the quality of their physical and mental health. This entitlement includes freedom from neglect, abuse, and misappropriation of funds. Neglect and abuse are criminal acts, whether they occur inside or outside a nursing home. Residents do not surrender their rights to protection from criminal acts when they enter a facility. What are neglect and abuse? Neglect is the failure to care for a person in a manner which would avoid harm and pain, or the failure to react to a situation which may be harmful. Neglect may or may not be intentional. For example, a caring aide who is poorly trained may not know how to provide proper care. Examples include incorrect body positioning, which leads to limb contractures and skin breakdown, lack of toileting or changing of disposable briefs, which causes incontinence and results in residents sitting in urine and feces, increased falls and agitation, indignity and skin breakdown, lack of assistance eating and drinking, which leads to malnutrition and dehydration, lack of assistance with walking, which leads to lack of mobility, lack of bathing, which leads to indignity and poor hygiene, poor hand washing techniques, which leads to infection, lack of assistance with participating in activities of interest, which leads to withdrawal and isolation. Ignoring call bells or cries for help. Abuse means causing intentional pain or harm. This includes physical, mental, verbal, psychological, and sexual abuse, corporal punishment, unreasonable seclusion, and intimidation. Examples include physical abuse from a staff member or an intruder or visitor from outside the facility, including hitting, pinching, shoving, force feeding, scratching, slapping, and spitting. Psychological or emotional abuse, including berating, ignoring, ridiculing, or cursing a resident, threats of punishment or deprivation. Sexual abuse, including improper touching or coercion to perform sexual acts. Substandard care, which often results in one or more of the following conditions: immobilization, incontinence, dehydration, pressure sores, and depression. Rough handling during caregiving, medicine administration, or moving a resident. Misappropriation of property funds means the deliberate misplacement or misuse of a resident's belongings or money without the resident's consent. Examples include not placing resident funds in separate interest-bearing accounts where required, stealing or embezzling a resident's money or personal property, such as jewelry or clothing. Nursing homes are required by federal law to have intervention strategies and regular monitoring to prevent neglect and abuse. The nursing home must reevaluate these measures on a regular basis.